Hello and welcome to Spinal Mastery Blueprint. My name is Tony. You can call me Dr. B if you'd like, and I will be your guide through this journey. And I am the creator of this program, Spinal Mastery Blueprint. So obviously you made it here. Thank you. I won't take too much of your time, um, but we're here because we've had a challenge in our life and we're seeking solutions. Are you finding that your ability to work and function is, becoming serious jeopardy for you? Usually, when we have some kind of a back problem, it can go from low grade to high grade over a period of time. And when it goes into that high pain mode, it can affect us in so many ways. It can affect our psyche, it can affect our confidence, it can affect our ability to work and provide. And, there's nothing scarier than having, a big problem in this area. It really shakes you to the core. And so, my whole purpose here is to improve your back condition before it's too late to change course. And what I mean by that is if you're experiencing muscle spasms or pinched nerve or something like this, if you don't know how to handle these things and handle them quickly, they can take over your entire life and they can really shut you down. And this happened to me a few years back, and I'm happy to say that I'm working well, and I'm here to share my solutions with you. And I have friends and colleagues that I've helped, and I'm here to impart this wisdom upon you so you can get back into your normal living mode and decrease the amount of pills you have to live on, hopefully avoid a surgery, and other, and also know how to navigate the medical system, because the medical system is very complex, and they don't, at least in my experience, I wasn't given much time with my doctor. We went straight from physical therapy to a steroid injection to you need surgery, and none of those things were working for me. So we'll talk more about that. So that's the whole purpose behind this entire program. Working with me, you'll recover faster while avoiding the pitfalls of the medical system, and we'll go into some of those things here, and also we'll go into them in depth if you join the program. I guarantee improvement in your situation, or I will continue to work with you until you do. It's that simple. That's my guarantee. No bones about it. You are here to improve your situation. We're here to lower your pain. Even an improvement of 30 to 40% in lowering of pain can make a huge difference in your life, and I'm here to facilitate that. Let's go to the next. So, let's talk about back surgeries, because, when you have a serious back problem, this is one of the first things that comes into your mind. And it certainly came into mind when I woke up one morning and all of a sudden I had incredible pain in my neck, and pain radiated down into my fingers. And at the time I was a dentist, so let me tell you, it scared the bejesus out of me. And it really sent a shockwave through me fast. So this is the Mayo Clinic. They say that 20 to 40% of back surgeries fail. I think the percentage is higher. And they also found that if you have a second back surgery, only 30% of those are successful. So, do we want to even have one? Because in a lot of cases, I can get you well and we can avoid this whole scenario altogether. And wouldn't it be nice to not have to get cut on? So that's why I've created this program, is to prevent those who, are seeking answers to avoid a surgery. And if you have had a surgery, I can still help you. We'll get into that some more. And, if you're not sure about what I'm all about, and after this presentation, please schedule a virtual visit with me so I can assess your situation and make sure you're a good fit for my program. I won't waste your time. I'm not a heavy seller. hate to be sold too heavily. Either it fits and works, sounds like it works for you, or it doesn't, and that's how that's how I approach it. The link is already on the page here, but stick around for the rest of the presentation if you like, unless you know that you want to work with someone because you need help. The current medical model, I'll pull this down just a little. They treat back problems, or this is how they handle you, with physical therapy, medications, and surgery. And the medications can be anything from Tylenol or an Advil, all the way up to, opioids, and also things like gabapentin and things like that. Anti-inflammatories, muscle relaxants, you name it. They'll try to give you a pill so that way they don't have to spend hardly any time with you. At least that's the way my doctors handled me, and so many people that I've worked with, that's their story as well. And after the medicines fail, they're going to send you to physical therapy, and you might find that to be lacking as well, especially if you're in a lot of pain or you're having pinching nerves or muscle spasms, two of the most painful things I've ever experienced in my life. And that's also been the case with many people that I've helped. They tell me the same thing. It's the most painful thing they've ever gone through. And so when you're hurting that much, you are thinking, boy, if the doctor could just fix me, give me that surgery and everything will be dandy. But you saw in the previous slide that, that's not always the case. And, once you get cut on, things have been tampered with in a way, and nerves are very sensitive little, cells. If you agitate them, you can make them much worse. Being on drugs, of any kind creates a physical dependence, and even if it's not a physical dependence, it can be a psychological dependence because you need to have that pill every so often just to function and to get by. My goal is to get you off the majority of all pills. And, physical therapy, I don't know, it failed for me miserably. So I have physical exercises and help that have been extremely beneficial that I never learned through a physical therapist. And they're incredibly simple, which blew my mind how simple it was, but it provided me with a tremendous amount of relief, and I'm here to share those with people. And as we know, surgery is not always that successful. In my situation, when I asked, the guy wanted to have me do a surgery on my neck because I herniated a disc in my neck. I said, okay, what's the chances of success if I have this surgery? He goes, 50%. And I said, well, thank you, but no thank you. That's not high enough for me to, go through with this. And at the time I was 53 years old, still a relatively young person, I thought. And, once you start having one surgery, sometimes you have to have another and another and another. And I just thought, no, I don't want to go down this path. So I had to find something else. So unfortunately, the medical system has kind of a cookie cutter, one size fits all approach. And after the physical therapy and the medications fail, they're going to have, before you get the surgery, they're going to have you get a steroid injection, and it may not be optimal for discs. Steroid injections are excellent for like your knee, your shoulder, your hand, where you have an arthritic joint that, needs the inflammation brought down. But on the spine, it doesn't work that way necessarily. These nerves are incredibly sensitive. The discs need a proper amount of blood flow to heal once they are ruptured or herniated, as they like to call it. When you give someone a steroid injection, it actually decreases the blood flow to the area. So that, like I said, that's not the best thing for your disc. But they do these procedures day in and day out, and they do them because they can get paid for them, through Medicare or through your insurance. They can get paid through that. So that's why they like to do them. Now, if the steroid injection is done improperly and they happen to hit the the neural sheath on the spine or go into the nerves itself, you can end up with damage that can hurt for years. So steroid injections may not be optimal. My methods allow you the body to heal naturally. I implore certain tools depending on what your problem is. And I have a number of modalities. So if one thing doesn't work, we can try another modality and go down the list. And the bottom line is just you get better faster. That's all we can do in life is our bodies ultimately are going to heal themselves, and we need to heal them quickly and as fast as possible. And that's so you can live your life. That's all you want to do when you're hurt. You just want to get back to where you were. Sometimes it just seems impossible when you're, in the midst of the pain and the spasms and just the general discomfort. You start losing sleep. You burn through all your happy hormones, and you're stressed out. You're aging yourself much faster. It can really wreak havoc on you. So my goal is to avoid surgery and to take less pills, and I've got the tools. I'm so eager to share this with all. Let's go to the next slide. Hopefully we can do that. So yeah, consider scheduling a virtual meeting with me. Here's my link that's also on the sales page. So here's another thing out of Harvard. 80% of people 4 out of 5 Americans at some point in their lives will have some kind of a back challenge. And it's one of the most painful and non-life-threatening conditions. It's right here on the top here. And of course, if you have back pain, they're going to talk about medication and exercise and changes to your lifestyle. But, the changes to your lifestyle, what happens is everything starts to close in and you do less and less and less. And that's not really working. And exercise is fine if you can do them comfortably, great. But if you can't do them comfortably, then what can you do to keep your body healthy and to move forward? And of course, medications have side effects. They create dependency. And so these aren't the answers. So, and even Harvard says themselves, surgery is useful in a minority of people. But you wouldn't believe how many surgeons I've talked to, and all they want to do is do the surgery. And people that I work with, they tell me the same story. They're just shuttled right into that avenue of having surgery. And, of course, that makes money for the medical practice and the hospital or whatever. But, that may not work. And then, of course, you can try a number of different things. But the key is you just want to get out of the pain. And, if you don't do my program and you're suffering with pain, it's like, how long are you willing to live with that? Are you really willing to live with this and go through this for a long period of time? Or do you want some solutions that work quickly? Here's another thing that I found was 3 out of 10 people suffer from lower chronic back pain. And, this is terrible. And they suffer greatly over long periods of time. And a lot of them have basically resigned themselves to living this way. And it's like, no. I mean, don't accept that answer. My brother, when he was I don't think he was even 40 yet. He was working in his yard, and this is before I got into the back stuff. This is, 15 years ago. But he hurt himself working in the yard. He kind of ignored it, didn't pay much attention to it. Then the next thing you know, he couldn't do anything, and he was having tremendous back spasms and pinched nerves in his legs. And of course, he went to the best doctor. He had an excellent job. Excellent medical insurance. He made lots of money. He went to the best surgeon in the whole area, and next thing you know, he has the back surgery. Well, guess what? Nothing improved. And so he had a second back operation. Nothing improved, maybe just the slightest bit of improvement on the second operation. And still to this day, he's suffering. And, I've shared my techniques with him. He's got himself to a point now where he is comfortable most of the time. He's had to make some changes in how he works. He has to stand up instead of sit down at a desk. But he's doing better. He had a massive atrophy in one of his legs from the pinching of the nerve. It destroyed the muscles. He's got a lot of his muscle back now. But the poor guy, after 2 surgeries and all my help, he's still reluctant to go on a long drive or a long plane trip. So my goal is to help people before they even get to this point. Once you get to this point, it's really hard to recover, because you're so used to it, and you're living on the pills at this point. So let's go on here. First of all, I'm not a physician. I'm a medical intuitive. That's what I am. I get into it. What's wrong with you by you just telling me. I don't even need to see the x-rays or anything like that. You can tell me the story of the x-rays and things like that, and I can figure out kind of where you're at, where you need to go in order to recover. And if you've already had surgery already, well, the slope is steeper, but I can help you still. There's many causes of back pain. There's everything from pulled muscles to a nerve that got pinched to, you got a cyst or a tumor, cancer, or even a back infection. I know how to figure out those things relatively quickly so you don't have to waste time worrying about those things. We can triage it so quickly and figure out, how to rule these things out so we can get it down to something that's manageable and you can take care of. There will be some instances where there is surgery needed, and no matter what, there are some conditions where we got to do the surgery. There's just no way out of it. And at least you'll know these things when you go through the medical system. Nerves do have the capacity to heal, but the results take months to years. It's not something where we're going to snap our fingers. So we don't want to destroy the nerves too much. We want to get busy and get you in a good place as fast as possible, so that way we don't destroy the nerves. Like I said before, physical pain just affects you mentally, emotionally. It goes so far beyond just the physical limitations. It affects every facet of your life, from being able to dance with your wife or your partner to, go on a long trip in a car, to be able to do your job effectively. I mean, there's so many ways this affects people and limits people. We got to get people in a better place quickly. And with the tools that I have, you'll be amazed. You'll be amazed. I amazed myself even when I had the problems. Like I said, I had a herniated disc about 3 years ago. I never got surgery. I have minimal pain, and once in a while I get a little bit of pain, and I do these postures that I will teach you, and it gets rid of them. And I don't have any problems. And we've even found ways to stimulate my stem cells, so that way my body can heal itself. That's the key to life, is your body's going to heal itself. Nothing on the outside is going to heal you. The surgeries and all this other stuff that's done is to help you with the acute phase of the injury. But ultimately, you heal yourself, and that includes any disease. And I want you to know that there are ways out. Don't lose hope. The mental mindset is so critical, and I'll help you with these things. It's so important to overcome these problems. I can't wait to share my information with people, and each person will have a customized, tailor-made regimen that they can do for themselves. how the program will work is you'll have an onboarding consultation with me. I will direct you to a course that I've put together. Since people have many of the similarities in their problems, I'll send you to the parts in my course. They're short videos that target what your problem is. So you don't have to spend like hours going through material trying to figure out, when is he going to get to my problem? I'm going to send you right to your problem. You're going to watch those videos. You're going to implement the things that I have suggested, and then through an encrypted messenger service, you can ask me questions and get feedback. Also, when you come into the program, we're going to have you join a private Facebook group so you can share war stories with others. And I'll be doing StreamYard lives on that private group. So that way we can learn about new things and changes, and also to get your questions answered. And of course, if you have private questions, we'll do that on the encrypted messenger service, just like you would with your physician. So I urge you to either go ahead and sign up here on the sales page. You certainly can do that, or you can set up a little consultation appointment with me. And, you know, if you're not sure, we can talk about it a little bit. I'm not into hard selling, like I said, so I'm here to help people. And anything you share with me is totally confidential. I don't talk about it with my wife or anything. And so I'm here to help. I'm here to impart knowledge and share my techniques that have been highly successful to many people. And it's just an exciting time. So please consider working with me. And I wish you the very best in your quest. And with that, I'm going to sign off, and I hope to see you and talk with you soon. Goodbye.